Good morning, Breakfast with Bacon fans. The man you see on the screen is a man of my own heart. We are going to do our best to keep this show short because he has an interest that will totally engage all of you. His story, his research. This is Dr. Joseph Malone. He is the author of the book Battles of the Sexes: Raising Sexual IQ to Lower Sexual Conflict and Empower Lasting Love. I told him to have the book there. So exciting. Joe, I am just thrilled to have you here. I can tell them about where you got your degree and stuff first, but thank you for coming on the show.
It's my honor, Christine, and thank you for having me.
Well, you, just so people know, you're a PhD and it's in health and human performance, right? And you'll tell a little bit about your story because your specialty is women's health and sexual wellness. And I'm sure your wife is probably like, oh yeah, honey, go ahead and
She's heard
tell
enough.
us how an expert you are.
She definitely doesn't want to come to any of my presentations or anything anymore. I'm on my own.
Just my husband, because I talk about communication between the sexes. So we really are kindred spirits. I studied and considered an expert in the communication strategies between the sexes. And you are just such a perfect complementary expert because you're actually taking the physical side. What happened that got you into this? You told me a great story about when you started studying and working with the college age students. Do you mind taking us there?
I do not, Dr. Christine.
And call me Christine.
Yeah, okay. Yeah. Yeah. I'm just in the habit of some of my colleagues. I'm always calling them doctor. It's a long story, but I'm going to try to shorten it up very, very quickly. I was working in the fitness industry here in the Nashville area and was discouraged because there's so many folks that were coming to us in the mid 90s to about 2005, 2007 that were unhealthy because of the lifestyle. It's a wealthy part of Nashville and the business traveling lifestyle. Ended up dealing with some people, literally having my hands on their chest, giving them chest compressions because they had a heart attack. I was considering getting out of the fitness industry, the whole health and wellness field, even though I'd spent, decades in it before. And I had a chance to go teach at this school called Middle Tennessee State. It's a university that's near Nashville, the other side of town. And again, it was providential basically because I really wasn't looking for that. But I went there on a master's and taught in the health and wellness department, and was made aware of this research that was somewhat new at the time, and it dealt with, let's just call it maternal imprinting. It's called by various names, but basically what it means is that girls and young women at the time that they carry their babies, time that they're pregnant, the health state that they're in has a huge effect, either positively or negatively on the baby. And notice I'm saying baby and not fetus. So what it comes down to, the bottom line is that if they're extremely healthy, if they have extremely healthy muscles, bone, and fat, then the baby, who basically makes themselves off of those ingredients, I guess you'd say, turn out with all the different organs really, really highly and well built: the kidneys, lungs, liver, brain. If it's not that situation where, especially like in the third world where they don't have enough food and babies come out really tiny, like our premature babies, like less than 5 pounds, defects get built in. And if it's at the top end where it's 11.5 pounds or more, where in our country that's more common because we have so many girls that are suffering from obesity, then the defects get built in. So somebody said, that's an important insight, that you come across. You should try to do something about that. And I did. I created a women's personal conditioning class there. And for 5 years, I taught it and had I had 5 men take it during that time period because they had different professions they were going into where they were going to be dealing with women. And it was fine. But most of the classes were all female, about 20 college women. And along the line there, somebody mentioned, well, we should do a PhD around that. And so I did. In the course of getting the PhD done, I interviewed 32 of them in depth, which like an hour and a half interviews each. And then 10 focus groups where we went through like 2 hours of questioning with them. And the things that came out were the things that you'd expect, as far as it was hard to get good nutrition on campus. It's hard to get the time to exercise and know what they were doing, exercising and all of that. So all the things I can't come into it expecting, I saw. And by the way, again, the purpose of it was that if you work with one of those young women basically and get them, really, really healthy, the idea was as a multiplier effect
Yeah.
for getting their kids. You're affecting the future there if you get just working with one of them
Yeah.
at a
Healthy
time.
mom, healthy baby. Yeah.
Exactly. So in the course of it, though, Christine, what came out, what really hit me in the face, slapped me in the face, I guess you'd say, is when they started sharing with me about their lives. They started bringing up this thing called hookup culture, and I really, I'd been on a college campus, I ended up being there for 12 years. Really I didn't perceive it, myself, but they made me aware of all this kind of norm that they're supposed to just have casual sex, and probably the weird thing was if they liked the guy, they weren't supposed to have sex with him. If they didn't like the guy, they were supposed to have sex with him.
Yeah.
That was a weird thing.
A
And
short side note, which is kind of important.
yeah.
I did a
Mhm.
whole radio show with college students. I did several of them, a series, and we talked about
Mhm.
hookup culture.
Yeah.
And there are actually rules to the hookup, just so our viewers understand. For
Right.
instance, if you go home and you sleep with somebody, you're supposed when you wake up in the middle of the night, you're supposed to sneak out and not so you don't have to know each other's names if you don't want. Usually, first names, and you don't have to establish what they call a relationship. So what they've come up with even new words such as situationship. And that's where the hookup came. And because they were trying to define this thing that was, and the second rule, if you quote unquote caught emotions, you were the fallen person. You were the broken person. You made the mistake. The person who didn't catch feelings is doing it right. And guess who usually was the one that caught feelings? The
Yeah.
female.
Right. Exactly, Christine. I couldn't say that any better than you just did. And so this shocked me. I went to the people, the powers that be there, and told them the situation. Luckily and miraculously, I think it's providentially, maybe God allowed them to say, yeah, we think that's important. Nobody else is doing that, so go ahead and you can pursue that. And so the book that I was writing that I showed earlier, it turned from an overall, a standard, really mostly college or young women's wellness type of a resource to a college women's sexual wellness, and then young women, basically a sexual wellness resource. So I did a ton of research and didn't realize it at the time, like, because I was pretty naive coming in from the fitness industry, but having set up the class for just one, for the girls, even though 2/3 of the girls on campus that were taking personal conditioning were choosing to take the women's personal conditioning, although they had the choice the whole time to take the standard as well. So 2/3 of them were choosing to take the women's. With all that said, I did not go along with, and this is kind of moving up towards 2017. I did not go along with the gender ideology ideas, the sex is a social construction ideas, that there really are no difference, physiologically between males and females. Because of course, by that time, I knew way beyond biologically, the differences that we're going to go into in a minute here. But they canceled me at the beginning of 2017, and I thought to myself, okay, God, what's happening now? I've got this book, and then I've got this PhD, got all this knowledge, and now I'm no place to use it, no place to teach. But miraculously, again, folks from Princeton read the book, and they got a hold of me. They have a group called the Love and Fidelity Network. Anybody can take a look at that if you want to. It's a great group up there. But they have organized groups on each campus, starting at Princeton, but then throughout the Ivy League, and then also Notre Dame, Stanford, Hillsdale. They have these Love and Fidelity groups where they pledge themselves to live chastely, save sex for marriage, that type of thing, traditional courtship. So I got to go up and speak to them at their conference, their yearly conference, and it was just a wonderful experience. And then from there, there's been Christian groups across the country, really, college students on campuses, I should say, that have shown interest in having me come speak. And then also the pregnancy help pregnancy care movement, I guess you'd say, pregnancy help movement. I won't go into the details on that, but it was a providential way that I got connected to them. And I'm working with them to create a women's sexual wellness resource manual, and have spoken at their conference 3 or 4 times. So God has been good as always, and he's put me in this position where, as you said earlier, very, very generously, you know, I've become an expert at this in this area that I really never expected to be. But I really know a great deal about the women's perspective on it because of my background, but I also have learned, of course, a great deal about the male situation. So I think today we're going to go into some of the background, I mean, some of the science on the females, and maybe at a future time we can, for those who have sons out there, we can hit the male on a later podcast. But that's what the way I'm looking at it is I'm going to try to address my remarks here today to be helpful to mothers and grandmothers out there, so especially that can use this information to help their daughters and granddaughters maybe have a better chance in the middle of this hookup culture.
Yeah, well, it's already a promise because you and I love this topic way too much. For all my viewers, we will be doing a show that has lets them, because you know you're a doctor, and we know that we have a singular circulatory system, a singular respiratory system. All of our systems are complete except for our reproductive system. I only have 50% and you have 50%. We can talk about the women all we want, but I am sure that there are equal and, you know, life-changing wisdom that we need to have on the males and their, you know, input
They're
to the
complementary.
females. Yeah, sexual health.
Yeah,
Absolutely.
exactly. And might I say, I'm new. I just converted in Easter of this past year, so 2023 Easter, and so I'm new to Catholicism. But one of the major things that brought me to Catholicism, to the church, as is said, is the church's teachings on human sexuality. Because with all the expertise that I've gathered and all the knowledge that there is out there, and I think again we can share a lot of it today, the Catholic approach to sexuality with the procreative and unitive approach, open to life, all of that type of thing is the optimal approach as far as, again, scientifically.
Well, just go there. You're there. Let's start there, and then we'll go with, you know, what are ways of improving our sexual IQ and our sexual conflict.
Yeah. Okay. Well, let me turn to I've got some notes here, so I don't want to make sure I don't forget anything. Young women in their sexual behavior, for instance, the way they, again, this is right up the alley of grandmas and moms, but the way they conduct themselves as far as their dating and that type of thing, their approach to whether they're open to premarital sex and that type of thing, affects their chances for women's reproductive cancers greatly. So a woman or a woman that has early promiscuity, that leads to higher chances of vaginal and cervical cancer. So starting from the outside of a woman's anatomy, we can kind of work our way in as far as the behavior goes. So early promiscuity is really, really bad for us, the young girls. Now, here's where it gets really interesting. None or minimal numbers of pregnancies and none or minimal breastfeeding raises your lifetime chances for developing ovarian cancer and uterine cancer. Wow. So again, the idea of going childless, or maybe just one or maybe 2 children, really it plays havoc on her system. And there's a reason for that. The women's systems are generally, and this is don't worry if you happen to be out there and you don't have any children or many, but just on average, on a population average, women it seems, are meant to have children, have many of them, and breastfeed them. The reason I say that is because of the things I'm saying here as well. But literally, the way a woman's cycle works is, first of all, she starts out with 7 million eggs in utero. And then by the time she's born, most people probably won't know this, but by the time she's born, there's 1.5 million eggs. So they just start out, pretty numerous, and they start degrading throughout her life. At puberty, she has about 400,000 left. Wow. And of course, every cycle, there's 2,000 or 3,000 that come up every cycle, even more, maybe 4,000 that come up, and there's only one that ripens to be the follicle that is used. But that one follicle, when she starts her period, that one follicle that ripens, when it bursts out of the follicle, it scars the ovary. So having a lot of cycles over a woman's life just raises the chances of a mutation there, as opposed to if they have less cycles. Now, our ancestors had about 160 cycles in their lives, because they're most of their reproductive life they were either pregnant or breastfeeding on demand, which kept their cycle from starting up again. So they had 160 cycles on average. Guess how many our women have these days?
Well, I'm going to cut that by 10, because they probably used to have 10 or 11 kids. So it's I don't know, 20, 30, 50.
Well, actually, it goes the other way, because
Oh, yeah. They have
yeah,
10 times
so
as many. So 1,600. Yeah.
yeah, and it's not quite that many, but it's hard hitting people with these figures right off the bat. But it's they had about 160, and we have about 450, 450 lifetime cycles
4
per
times
woman.
the amount. Yeah.
Yeah, just like you said. So basically, they have 4 times the chance of having a mutation. So that's how that works. And then again, not having as many children, again, being open to life, like as a Catholic beliefs go, is very, again, healthy for the woman, as well as, of course, the children. But starting it younger too. So having babies younger, and then again, you and I and many others would advocate getting married first before you start having babies.
It's ideal.
So yes, and so again, that sex drive that we're going to talk about, there's a purpose there. It's making young men and young women want to have sex with each other. But again, in the old days, like 1960 and previously, getting married was a requirement. So it drove them to earlier marriage, or about around age 20 was the age of average marriage back then. And so they started having babies younger. They had more of them. They breastfed them. And again, they ended up with all the lower risk on all of these different things. Having the babies younger is another surprisingly important factor, because a woman who has her first baby around age 20 has half the lifetime risk of breast cancer that's a woman who has her first baby closer to the age of 30. So that every time, again, a woman, again, they've got 400,000 eggs left at puberty. And so those eggs they're getting older each month. And as opposed to the sperm of the men, the boys and men, it's renewed all the time. There's freshly made, like 2,000 a second. So with women's situation, again, the picture of the past, the traditional courtship, and again, driving young people to get married sooner, starting their family sooner, hitting the girls' age of peak age of fertility, which is 19 to 29, and the guys is 24 to 26, hitting that instead of getting married maybe right around age 30, and then starting to try to have a child at 32, 33, 34, is really wise. Because one other thing that's going on with this is that, and some people have been sounding the alarm on it, but there's something called birth gap that's going on now worldwide, where we're way below the replacement rate. So in South Korea, which is the worst of them, to give you an example, it's a 0.7 birth rate. So rather than have 2.1, which is what we need to be able to replace ourselves, they're at 0.7. And so example of what's happening in their society is they have only 4 grandchildren for every 100 grandparent age. Yeah. So in other words, they don't have enough young people coming up to be the productive workers to be able to.
So the old people are dominating the country. They're all going to die, and they're not going to have that many children. And the country's basically going to cease to exist if it doesn't change.
Exactly. It's kind of the opposite of the population bomb that we grew up with, during the 1960s and such. It's just the opposite. One other thing on this before we leave it. All this is really bad on women, because as we're going to see, you have twice the chance of getting an STD, STI, however you want to refer to it. But women with 10 or more lifetime sexual partners, they found, have a 91% higher chance of developing cancer over their life. And breast cancer has become the scourge really of our time, because as of 2020, it became the number one cancer diagnosis in the world. And again, only 1% of those cancer diagnoses with breast cancer are males. 99% are females. So it passed lung cancer, with all the smokers we still have around, it passed lung cancer. So we have 100 times more breast cancer in our women's population than our ancestors did. So, and there's a variety of reasons for it that I just kind of went into, but again, going with the Catholic approach to courtship, marriage, and family, you really solve a lot of problems with that. And our girls these days are just on the opposite pathway, most of them. So we need to help them with that. Daughters and granddaughters, we need to get the word out on, their future health is depending on how a lot of how they behave now.
Doctor, what were some of the things when the Lord woke you up and you wanted to start studying this? What were you learning from these young girls that had been involved in many hookups? What kind of health problems were you seeing that made you realize, wow, you've had so many partners, and your depression, physical ailments? Could you list 2 or 3, or what were you
yeah.
seeing?
Yeah, I'd be glad to. Anxiety was probably number one. Depression, probably right up there, probably a tie with that. Self-loathing, self-concept going down. I had even sorority advisors, because it developed into a kind of a campus-wide program, because I had sorority women in the class, and they had me come and work with their sororities. The sorority advisors would tell me that they would sit down every once in a while with each other, and they would have a conversation over why these young women allow these boys to treat them the way that they do. So I saw a ton of that. And then the next thing I probably should address is related to that, because with a lot of them, they were under the impression that they needed to do that. They need to be sexually active with these young men in order to have a chance to have a relationship with them. And it turns out that that's quite the opposite to what the science shows. So what the science is showing now is that males and females bond differently. And when females have sex with a male, generally they do bond very strongly, because the process is based on biochemically on dopamine and oxytocin, of which they get both of them. They get a lot in a sexual situation. With males, though, it's actually much more complex. So their bonding system is much more complex. They need dopamine, they need testosterone, and their bonding chemical, which rather than oxytocin is vasopressin, needs to be present. And
which one is it?
Vasopressin.
Oh, I called it vasopressin, which is the monogamy hormone.
Correct. And people pronounce it both ways. Yes, vasopressin or vasopressin is the one that's important, the most important for the guys. Now, the key thing on it, Christine and our audience, is that when a young man is hooking up with young women, the process of orgasm, just to be, again, hopefully not too
it's okay. I will put a little disclaimer underneath and let people know to be discreet.
Good. You almost can't address this topic without being.
Look, we're in 2023. People talk about so many things directly.
Yeah.
We may as well take ownership of the good stuff.
Yeah, because this is really good to know what to do with this. When they're hooking up and he's having an orgasm after orgasm after orgasm with different girls, the vasopressin depends on that not happening, and it depends on the old school style or the Catholic style of dating, respecting each other, chivalry, that type of thing. Him being around her and being attracted to her, being sexually stimulated in a way, but not to the point of orgasm. And the vasopressin then stays in the brain area, and it stays long enough for it to create receptors, which this This is what its receptor looks like in the brain, but a million times enlarged. And if they're dating this way, they're being, chased. Again, ideally, I would say, wait until you're married to get married. I mean, to have sex.
Have sex.
Yeah. The molecule can eventually, because it's been there long enough and it's helped create these receptors, it locks. And so when the vasopressin molecule locks, then it lowers his testosterone level. And when the testosterone level lowers, then the oxytocin, which has been there the whole time, males have oxytocin as well. It's secondary to the vasopressin though. It locks as well. So he has a 2-stage bonding system, whereas she only has the 1-stage, which is again just dopamine and oxytocin. So your typical hookup situation, as you described so well earlier, the kind of attitudes they have about not even wanting to see each other afterwards. So many of these girls fall in love, basically, which is, that's what's meant to happen in that kind of situation. And they have all the broken hearts and all of that. And the guy, because of this situation I just described, where the vasopressin gets washed out, he's on to the next one. Especially if it's like Tinder, he's swiping for the next girl. So that was something, to your question. Once that research became clear to me, I realized, whoa, this is a built-in horrible situation for these young women, and they don't know, but they're their own worst enemies there. So
but we're built to be monogamous physiologically, and not just a Catholic Church teaching.
Correct. And the women, here's the key understanding: we're a monandrous species, and monandrous is the Greek word for one, mono, and androus is for male. One male. We have, coming from most women, not absolutely all of them, which makes it difficult, but most of them, 80 to 90%, they have that monogamous instinct in them. We're a one man woman species. That's what monandrous would be.
Yes.
And so in the past, for especially our grandmothers that are listening to this, you can remember the times where, girls and young women, there was a strict code that you didn't want to end up being that kind of a girl, so you practice chastity, you practice modesty, and all of that type of thing. Come to find out, that works. It works as far as helping the male to bond. So there's that aspect of it. The other thing that girls don't realize and young women don't realize is that when they are sexually active with these young men, it turns out that the young men categorize them readily. They categorize them, not all of them, but most of these young men, especially the high testosterone alpha male types, and the ones that have been around with a lot of women, they'll categorize right away to for a good time only or for marriage. And it turns out that sexual integrity and sexual loyalty are the most highly valued traits for a young man who's actually looking for a long-term marriage partner. So what we've got, Christine, is we got these young women with the idea in their heads, and some of them have got this idea from their parents. Their parents told them this, and the parents that told them this, I literally had two young women tell me this. Their parents, one was a dad, one was a mom, but each case they messed up their marriage by cheating in their marriage, and then they told their daughters that they had to have sex with guys in order to have a chance to, in order for them to bond with them.
Try it out, right? And I'm with
right.
you. I'm my PhD, as I told you, that it, is communication.
Mm-hmm.
So the communication between the sexes pairs just perfectly with what you said. So the social science research has shown a bell curve. For instance, males are most attractive. You have the impossible women. It's like, I'm never going to get with Jennifer Aniston. So they're not attracted to her because she's impossible. So they don't even consider it. Then you have on the other side of the bell curve, the easy women. I can get her anytime I want. So that's unattractive. So the bell curve is the girls that aren't impossible, but the one I can work towards. And so those are the ones that actually they go after, and it's raising their testosterone. And if we're to be monogamous, their vasopressin as well. So in my classes, would put the girls on one side and the guys on the other. This was so much fun too, because they'd ask each other questions. And so I'd present that piece of information and say, guys are more attracted to the girls that are quote unquote hard to get. And every single guy, no matter what his ethnicity was, no matter what his age was, they're all like, yep. They're like, we want that girl, but that's the one we want to marry. But one guy was, at least he was honest enough to say, but hey, we want you easy girls too for now. you know,
Right.
and that the girls actually heard them say, yeah, if you're easy, we still want that because we're going to use you, but we're going to be attracted to the one that doesn't say yes.
They want them temporarily.
Physiologically and sociologically, this all falls into the same truth of the Catholic faith, you know,
Yes.
one man, one woman for life.
Yes. And they're complementary. In addition to that, again, this is something that I need to do a better job of getting across, but in these young men's heads, hearts and minds, and some of it may just be unconscious even, but like you said, you know, if the girl is going to be easy with him, if she's easy, then in his mind he's thinking, well, she's probably easy with everybody else. And this, again, classic, you know, scientific approach to it, female choice over the generations, and not just our species, but most species, the male has always had to show some kind of you know, ability to provide resources, also get across that they're going to be loyal, you know, once in our monogamous species, once she's pregnant and that type of thing. So so there's female choice. The females they've got the goods, you know. Again, the egg is the largest cell in the body. It's 10 million times the volume of the sperm, and so much more rare. So they have the goods, and they have the ability to demand certain things from the males. But on the other hand, and this is what the girls need to understand, coming from his brain, way down deep inside of it, again, maybe unconscious, is paternity certainty. You know, he wants to know that the woman that he commits to for his life, the babies that they have are definitely his, and there's no doubt about it, because in our internal gestation model of being that we are as humans, only the woman really knows, you know, who the father is. So the girls need to understand, these guys, for long term and for marriage, they want to see somebody that they can depend on, and then they know hasn't been giving it out to everybody else before them. One other thing on this, literally after a couple has unmarried intercourse, generally, again, this is not every guy, but generally these guys will see her worth, her value, her attractiveness, how pretty she is, will decline 10 seconds after orgasm takes place. She starts declining in his estimation in all these different areas. Yeah. And then bad thing is that her estimation of him goes up, though. so you got her falling in love with him, thinking, well, he's such a great guy, and you know, the oxytocin and the dopamine have bonded her to him from the sex that they had. And so you got the one-sided situation there with the guy thinking she's not what I thought she was, and that type of thing, and her thinking, man, he's even better than I thought, you know, and I want to let's get married, you know, that type of thing. So it's no wonder we have so much sexual conflict. You know, you mentioned it earlier, and the book mentions it. So that's basically that's probably one of the most important things, I think, for young women to know about. And moms and grandmas, if you can get that across to them, that's so important. Going on, though, because I know our time is short, the other thing that young women need to realize about guys is that they're so much different in their brains. In the sexual pursuit area, there's 3 different parts of the male brain that are over twice as big as the female's brain. One is called the MPOA, medial preoptic area, and it's right here we're located right where the optic chiasm comes into the brain. So if females in general have ever noticed that males, even when they're like, you know, boyfriend, girlfriend, have a roving eye, not to make excuses, but there's a reason for it, as far as the way the guy's brain is set up compared to hers. And then, so there's that area. There's the INAH3, another part of the hypothalamus, which again, the hypothalamus is the seat of human sexuality. It's twice as big. And both of these areas are packed with twice as many neurons, twice as many dense neurons. The third one that's twice as big is the amygdala. Amygdala is the brain's command and control survival area.
Emotion center.
Yes, exactly. It's twice as big. And again, all 3 of them are
twice as big in the female.
Yeah, well, yeah, yes. It's the volume of it, though, for the male is bigger than the females. It may not be proportionate to the size of the body, but it's more reactive. It's more reactive to sexual stimuli, as opposed to the females is more reactive to food stimuli, if you can believe that. So, but all of the areas that I mentioned add up to the male being sexually supercharged, as far as especially when the female isn't in her fertile window of her cycle. The other thing is, well, again, they're all sensitive to testosterone, and men on average have 20 times more testosterone than women do. Some of them have 183 times more testosterone than the low testosterone women. So it's a real mismatch that way. And in addition, women have 13 times more of this interesting biochemical called SHBG, sex hormone binding globulin. And sex hormone binding globulin, it ties up the sex hormones. So, and particularly testosterone. So she has much lower testosterone levels. The highest woman's testosterone level is about 75 nanograms per deciliter. The lowest males is 200 nanograms per deciliter. So a big difference, 2.5 times difference there. But again, it ranges up to like 20 times on average. So there's all these reasons that guys act like they do when it comes to sexuality. Now, I have to preface that with and kind of qualify it with, these days with pornography the way it is, I think there's a lot of guys, boys, and young men that are unfortunately so numbed out on pornography that it may not be as much of a difference as it used to be, as far as these statistics that I'm giving you, because again, they're already numbed out to what would normally be the reactions they would have. But in general, girls and young women need to realize that there's a big difference as far as their tendency to want to have, casual sex kind of at the drop of a hat, and promiscuity. Men, another area they need to realize is that men, because of this, tend to perceive women's sexual interest. In a lot of cases, a female will just be being nice to a male and, just being courteous or that type of thing. And he'll be reading sexual interest. On the other hand, the female will underperceive his sexual interest. Oftentimes they'll think the guy is just being nice and friendly, and actually he does have sexual interest in her. Along the same line, that things that women and girls should know is when males get aroused, sexually aroused, their ethical compass seems to have a big problem. It goes south quickly. And what I mean by that is, they did the research on this, they did with college male students, and they had them in front of computer screens, and on the screens they had just pastoral scenes, country scenes. And they changed them, and they asked them questions like this: would you ever consider giving a date rape drug to a young woman to have sex with her? No. Would you ever consider telling a woman that you loved her in order to have sex with her? No. And when you didn't. Would you ever consider having sex with a 12-year-old girl? No. They changed the scene to pornography. And then they also upped the ante by asking them to masturbate to the pornography. Then they started asking the questions, and all the questions, as you can guess, changed to yes. So 80% of, and this probably from being on the campus that you're on, but 80% of non-consensual sex or sexual assault, however you want to frame it, on college campuses take place in the context of a hookup. So that whole sexual arousal situation, and of course alcohol is involved in 2/3 of those as well. The lesson here, parents and moms and grandmas, is that generally it won't be somebody jumping out from behind a bush, to attack your granddaughter or daughter. It'll be somebody that they're in the dorm room with, and they're drinking easy alcohol. Access. Yeah, easy access. So, again, young women need to be aware of that. That's extremely important. By the way, the first semester is usually the major time that this happens to these girls. And again, usually it's in the dorm, not the fraternities. That goes against what most people think. One other thing that girls and women need to be aware of is that chemicals in semen actually can affect their psychological state. There's things like endorphins, serotonin, prolactin, all of which make women feel better once, they absorb them vaginally. They feel better once the sex is over with. But again, women, as we're going to see, are so vulnerable to all these other problems, STDs and all that. that having open, non-condom sex is pretty rare in these situations where they're having premarital sex. So this to me screams marriage. It screams to me monogamy. It screams to me the Catholic approach to sexuality. Two other things basically in men's semen that also are factors to why married women probably are so well. The research shows that married women that aren't practicing any of that, condom type birth control are much happier, much less depressed than the women that are. FSH, follicle stimulating hormone, and luteinizing hormone LH, which can make a woman ovulate, actually, also are in semen. So it's as you said earlier, this system that we have set up, if marriage is the cornerstone of it, which I think both of us would highly recommend. It makes it all work. It makes it all work very beneficially. But if you aren't married, then you have to worry about all these different things and do all these things that are really harmful, especially to the woman. Last stat here that women need to be aware of about men is that, as opposed to our swimmers that we're having, witnessing the swimming situation with the man that isn't too great in the men's division, but he's great in the women's. Men have 80% more upper body of muscle fiber on average, and 50% more lower body muscle fiber on average than females do. So it's 80-50. And generally that means that in any kind of physical contest or any kind of like abuse situation, the males are going to be the ones that are going to be the abusers, and the females are going to be the ones that are going to be trying to survive it. So, our movies these days with women, the way they're portrayed, throwing guys around and just and all the unreal things that they're putting across in the entertainment really give, I think, a lot of people, including the girls, the wrong impression of the way things are. And again, all these things that can lead to danger. So that is basically the things that women need to know about men. And then if we have time, I've got some things that they need to know about themselves as well.
Let's just do it. I don't need to ask questions when you've got all the info.
Well, stop me at any time.
I don't want to.
Okay. Well, the first thing that again, very important, again, moms and grandmas out there, and maybe some young women that are watching this themselves, early sexual arousal, what we found scientifically is that it affects females differently than it does males. It raises their sociosexuality. And what we mean by that is their inclination to engage in casual sex and take, like pornography, anything like that, where that they might not do normally if they wouldn't have been sexually aroused earlier. It has more of power over them. There's something about early sexual arousal on girls that causes that reaction, and they didn't find that reaction with the males. So that's something to really be, cautious with the girls and young women in your life, is try to keep them from experiencing that too young. And it's hard these days because porn is being usually exposures like
it's being fire hosed into people these days.
Yeah, and age 10 to 13 is the average age of first exposure. So 10-year-old, seeing that.
So what you said is if, so let's just say a girl happens upon pornography at a young age, what you're saying is it arouses her, but then it makes her more hypersexualized than a girl who hasn't seen it. And she is more inclined to have more sexual partners, or at least to seek to satisfy that urge than girls who did.
Yeah, that's what I'm saying. It affects her down the road. It affects her whole life, basically. So protecting them from that, and it's terribly tough these days. I mean, how do you protect them with everybody having a phone and everything? So
well, let's talk about fatherlessness. That is the man's responsibility, and these children are being raised by their moms, and the father, who's supposed to protect her modesty, and he's supposed to protect her virginity, and he's supposed to protect everything about her, he's not there. She's left to figure it out on her own, or at least try to have mom help her figure it out. And mom's the same as she is, because mom's a female. We don't understand these things.
I completely agree. And the other thing is, going back to the behavior, females' behavior, affecting their future reproductive cancer risk. That's one I didn't mention, but having an unrelated male, in the household, like a stepdad, or maybe not even that, maybe as a boyfriend in the household, has a tendency to cause these girls to start their menstrual cycles earlier, and that's another risk factor for future cancer, is starting your menstrual cycle earlier. So what you're saying about having solid homes and eliminating fatherlessness as much as possible, everywhere you look, you win with that. Every way that you could possibly look at it in the family and in society, you win. So yes, going back to the traditional approach and the Catholic approach is extremely beneficial. And this sexual arousal, this early sexual arousal for the girls, is something that I think can be addressed much better if there is a married couple that are, watching over that. And if she has her biological dad in the family, and again, people that may be divorced and may have been, with somebody else, I don't want to condemn you, because I think there's hope there.
There is no condemnation when
Yeah.
you're just giving knowledge, but they need to have this knowledge.
Right. Preventing that and being able to create a marry well, help kids marry well and then stay married. There's
Help
so
the
many.
parents marry well. That's what I do. I'm
Right.
teaching you that your divorce hurts your children in so many more ways than you even knew. And you've just presented a very huge extra way of how that affects your children. So when you're just up, and I know what it's like. I filed for divorce from my husband. We were apart for 4 years before we reconciled. So I want always people to know there's no judgment here, but fight your backside off to make that marriage work for the sake of your children on so many levels. And this is huge. I didn't even realize that.
Exactly. There's all these other little things that, like you said, yours and my work really, they're complementary in a lot of ways.
Yeah, I think we're going to be doing a lot more work together in podcasts, because this is way too interesting for me.
I would love it. I'd be honored. So the next thing is, and this is a huge take home. I want everybody to hear. Alcohol affects women differently than it does men. Alcohol raises women's testosterone levels. So it also, inhibits the frontal cortex, the prefrontal cortex. So it raises
the
actually
decision-making part of the brain, which is where if I'm going to be like, oh, this is not wise, if you're numbing that. And testosterone, right. Just so that people know listening, makes you more aggressive. It's an aggressive hormone. So if a woman's testosterone's increased, she's going to be more aggressive sexually, physically than she would be if she wasn't drinking. That's what you said, right?
Exactly. And especially to add to that, if it happens to be around her fertile window, which if she's not on hormonal birth control, she's looking at, just to explain it to those that might not know, periods, first day of period would be the first day of the month, and then 5 days of the period. And then the days after that, where you start hitting 6, 7, 8, 8 through about 14 would be the fertile window. And if she's in that window, along with the drinking, which has raised her testosterone levels and impaired her prefrontal cortex, she can become what you just described, a very sexually aggressive, not like herself, basically, and not thinking responsibly like she would normally do. When we talked about the women earlier, it seems to me that God has equipped women generally with the ability to be the enforcers as far as sexuality goes. And while one of the worst things of the extreme feminist movement is attacking that idea that women are naturally chaste, they're naturally more modest, that type of thing, because they're the glue that have held this whole thing together, Christine and listeners, over these years. Again, pre 1960, we only had a 5% out of wedlock birth rate in 1960. Now we have 40%. Well, 2010 we had 40%, and different ethnic groups have, it's 25 in the whites percent it are born without a father. It's 50 in Hispanics, and it's 70 in African Americans. So different kids in our society are really going through some really terrible things because of what's happened. And again, I think when you go at the women and you make the girls think that, oh, you're not normal if you're not sexually driven, just like the guys, it's a terrible thing, because women in the past have been the ones that have enforced the law on this, and they've been really, really good at it.
Yeah,
and
it's been sexual gatekeepers, right?
Exactly. And it's helped everybody. It's helped the guys, it's helped them, and it's helped the society. So Alcohol, especially around the fertile window, can really make a big difference. I think that's why college fraternities have always been so alcohol oriented in their parties, because they know that too. Female anatomy, as I alluded to earlier, makes girls and women much more vulnerable to STDs, STIs. The vagina is much thinner skin than the penis, for instance. It's moist and warm, most of the time. And that is bad, of course, for bacterial growth. Women generally will have had the experience of a yeast infection. So again, that's where that's coming from. A really bad thing about STDs with women is that many of them are asymptomatic. And so they have them, they can sometimes have them for years, and they're really destroying like their fallopian tubes in there. Pelvic inflammatory disease happens oftentimes, and they end up getting infertile from it. A woman has, just on average, 8 times the HIV risk as a man does, and they have 4 times the gonorrhea risk. Overall, they have twice the risk of getting a STD as a man would with the same situation. Now, here's an important one too. And this is kind of hard to communicate, but it's important enough to take the embarrassment of communicating it. Most people don't realize it, but with our pornography situation we've got, there's a lot more pressure these days on women taking part in anal sex. Anal sex carries a 17 times greater risk for HIV, contracting HIV, than vaginal sex does. So women need to know that. Girls and women need to know that. And when the guys are pressuring them to do that type of thing, boy, HIV is still not. It's still really bad here, and it's death sentence still in most of the rest of the world. So, again, women are generally the ones that are the victims of these things. We
One
already
of the
covered
other things I learned
Yeah.
that they've been convinced of is and these are college girls, these are smart girls, and how the enemy has twisted their thinking. They want to preserve their virginity. So a lot of girls believe if they have anal sex that they're still virgins because they didn't break their hymen. And I'm like, Satan, I hate you so bad for trying to do that. It is just so destructive, and not the least of which painful.
Rest.
This is really, I tell girls, because I'm straight up I'm like, why would you want to do that when it's painful for you and extra pleasurable for the guy? What are you getting out of it? You're
Yeah.
being used. And again, when I say that in a way that the girls know that I'm loving on them, it's
Yeah.
like, this is where you need to show what you want. They need to please you. And then we talk about the how women want to be the center of your world, right? So you're more aroused, as you kind of alluded to with the physicality of it and the sexuality, is that when you want me alone, then I'm more aroused and in love and pleased, and to think that you want to do these things, I don't feel like I'm the center of your world. I feel like I'm just being used. And it's just that's why the depression and the
Yes.
anxiety and all the
Yeah.
other
Yeah.
wretched things that they're dealing with come from.
No romance anymore. And I think that's in my experience with young women in talking with them, is they longed for romance. They knew stories of their grandparents, and one of them talked about her grandfather being a veteran. He fought in World War II, and while he was over there, he in the sand, he was on the beach. He wrote "I love you" in the sand and took a picture of it and sent it. Of course, they didn't have the communications we have now. It's like you get a letter every couple months.
Right.
But she knew that story, and she said, "I want that. That's what I want for my husband to be." So, and this happened to be an African American young woman. So it was very touching, and I thought it said so much. Specifically, as far as hookup effects on women, 78% of women, again, these college studies they did, 78% regretted it. And they were, again, we talked about it before, more depressed than the guys were, lower self-esteem, higher general distress, and a great many of them wanted it to turn into a relationship when they were honest about it. So ugly picture, all of this. But again, we know that God has all the solution. Last thing I probably want to talk about, because we're coming up here on our hour, is hormonal birth control effects. And again, this was something, along with the young women's behavior affecting their future risk of reproductive cancers. This is something that caught my attention about the Catholic Church, because I know that the Catholic Church in 1930 was the only one that stood the ground as far as not accepting, hormonal birth
Right.
control methods and that
Any
type of
birth
thing.
control.
Any birth control. So bad news here. Birth control, hormonal birth control can, and this is things your audience may already know, knowing you and knowing probably maybe what you covered, but just in case, one of the worst things is that can make a woman attracted to somebody she wouldn't be attracted to normally, because it changes many of them, it changes their attraction from, if they're normally cycling, they're going to be attracted to more masculine men, more I don't know, alpha male types.
Right.
And again, there's that female choice situation where they have to judge out whether or not this guy's genes, if he's got great genes and all that, but he also will be loyal, and if he's gonna be honest and a good guy and all of that. But she'll not settle, but she'll focus on somebody who strikes her pheromonally, and we can talk about pheromones next time, all this unconscious attraction stuff. But is if he's a good guy, good dad, and good husband type of deal, she's gonna pick him, and they're gonna go, they're gonna date, and they're gonna maybe get engaged, they're gonna get married. Thing is, though, when they're maybe having sex along the way, unfortunately. So she's on birth control, and so when she goes off of it, and they try after they're married, then she starts trying to have babies. She finds that she's not attracted to him anymore, because now she's attracted to the more macho type of a male and that type of thing. So now that she's on her natural cycle, so that's a really bad situation. It raises depression and anxiety rates tremendously. Now, I always like to say that share the study, and you'll appreciate this. Many studies you could say to yourself, okay, they don't have a big enough sample size. Well, this was a study they did in Denmark, and they had over 1 million for their sample size.
That's a pretty fairly substantial size there.
Yeah, and they followed them for like 15 years. So what it was in the hundreds of percent increase in depression and anxiety risk for 15 to 19-year-olds, for them to be on particularly the big mega doses style of doing it, like the patch, the IUD, and the vaginal ring. And it was in the 80-90% increase for the ones that were older, as far as above 19. And all of them, whether it be the oral or the other type, they were for the most part in the 80s and 90s at least, higher risk of depression and anxiety. And what they found, Christine, and our audience, is hormonal birth control basically changes the personality, of these females. And you don't, the way they're dispensed and treated in our society, it's like, oh, here's just take this candy here, and you got a irregular cycle, here, take some birth controls. You got endometriosis, here, take some birth control pills. But they change their personality, and it's easier to see when you compare it to like anabolic steroids that some of the guys take. And many people, myself included, having the fitness industry background, I was around guys throughout that were on steroids, and boy, their personalities would change as far as being aggressive, because anabolic steroids are basically synthetic testosterone. And like you said earlier, right, it makes you more aggressive, makes you more your sex drive, it raises your sex drive and all that. So, but what people need to realize is that this hormonal birth control, it changes women. It changes who they are, basically, because that's a really big part of who you are, is that how that hormonal interchange and that monthly cycle, how that you work through that every month. It dampens, hormonal birth control dampens sex drive, and combined with antidepressants, which also, by the way, in the Danish study, they found that the need for antidepressants went way up with the young women, and particularly the younger ones, the 15 to 19-year-olds that were on it. So the other thing is, during the trials, they covered this up pretty well, but it really, really raised blood clots occurring, and also certain kinds of cancer. So hormonal birth control is, if you can avoid it, natural NFP, the Catholic Church endorses that. I endorse it. You may or may not endorse it, but the hormonal birth control, if you can avoid it, is really, really, really good to do so. So that's the picture really of what I would say that women need to know about men, or even young females need to know about males, and young females need to know about themselves, basically. So with that knowledge, in addition to probably what you've been teaching these years, I think there's probably a lot of good that can be done and a lot of harm that can be prevented.
And this just the cancel culture. Why on earth would they want to cancel this information? Because we have, this feminist ideology that's out there that has been spreading nothing but lies since the 1960s and before. And, so you and I have to do our part. If you're watching this show, please share this with every female and male in your life, especially the young ones who are just coming upon their sexual wake up. Please let them know. And if you're a young married couple and you're using birth control, please listen, please help yourself. I can think of several people right now of many who are on birth control and are depressed and married, happily married, right? So, Dr. Malone, I could talk to you forever. So first thing, we're going to do a second show that talks about, the men specifically, and I'm sure we'll do many future shows about this. But if we can leave them with, a positive thing, you've kind of put the positive things out there. The knowledge is power. What is the best thing you gained from this information?
What I came to, Christine, was that sexual wellness, and again, I'm a wellness way back when professional and expert, sexual wellness equals sexual integrity. Sexual integrity solves basically all of these problems, and sexual integrity, and then marriage, and then sex within marriage. So that would be the wisdom I would want to share, is just the importance of sexual integrity, throughout your life, throughout our lives, but particularly avoiding premarital sex and cohabiting and all the things that are so common these days, because they all deter from the reward that could be there as far as saving sex for marriage, and then having a happy marriage, as you said earlier, producing children, hopefully many of them, and the family that comes from that is just so amazing. My Ph.D. is behind me on the wall there, but let's see, I got to go this way. There's my real there's my real credentials.
The babies.
My two kids, who now have five kids that size themselves. So and again, if we would have been Catholics at the time that that our marriage went through, the years of our marriage, we probably would have had several more kids, because I've the old Protestant, have two kids and try to get wealthy type of a thing.
Yeah, and tell God when you're ready, and he better obey you.
Right. So the wisdom of the Catholic Church is really strong and it's really optimal. So that would be the same thing I would say, is sexual wellness is sexual integrity, and marriage, nothing else comes close, as far as fulfillment. I've got 3 degrees, and none of them compare. All 3 of them together don't compare to the impact on my life that my happy marriage that I've had for 46 years has had. So young people needs to be impressed on them too, that marriage is a huge factor as far as their success in life, maybe the biggest, other than their belief in God. So, and we do so little preparing for it, but I know you do a good job. This is your area as far as super couple, and you realize the importance of it, and the folks that are listening to us out there need to realize it, and just realize we put so much effort. You and I've seen college students throughout our careers, so much effort into getting that bachelor's degree, so much time, so much money, so much, having a second job, having a job while they're doing it, and all of that. And then they don't pay hardly any attention to their marriage that hopefully is out there in front of them, and no effort into preparing for it. So I would advocate, and I think you join me, advocate in seeing the importance of marriage and putting effort into that, putting effort into being as best prepared for it as you can be, and going down God's pathway instead of this crazy world we're living in's pathway towards it.
Amen. So you kind of answered the way I realized I asked you the question I always ask, but in a different way. Name one thing you'd have our listeners do differently as a result of something they heard today. And I think you just answered that.
Yes, sir. Yes, ma'am.
Hold up your book one more time. I would love everyone to purchase this book. Get it in the hands of anybody you can. Battles of the Sexes, Raising Sexual IQ to Lower Sexual Conflict and Empower lasting love. This is fantastic by Dr. Joe Malone. I think it should be in everyone's library shelf. And if the book is written half as well as you've spoken, it's going to be a page turner. So I look forward to getting my copy, which I should have had before I had you on, but I'm going to have it before we do our next show about guys, because now I think the girls are going to want to watch that.
I agree, and it's written for the university, the secular university campus situation. So just keep that in mind. I basically just used your natural and sexual selection and basically a scientific approach as opposed to a Catholic or general Christian
That's
approach.
okay.
So,
I think sometimes it gets in there because people think, your religion. Nope. This is just science.
Yep, that's what it is.
Fantastic. Oh, I'm so grateful. Let me ask you one more question, and then we do need to go. Fill in the blank. When I die, I will know my life has been a success
if I've lived my life for God, and through what he's shown me and the place he's brought me to here, if I've promoted as many happy marriages as possible and saved as many young people from that hookup culture life as possible as well.
Amen. Is there a website I can send people to if they want to get a hold of you?
Yes. drjoemalone.com would be my personal website. drjoemalone.com.
No punctuation, just DRJOE.
Yep.
MALONE. Okay, I'll put a link to it right here. drjoemalone.com.
And then sexiq.org would be the other one. sexiq.org. And that's the initiative my wife and I created to try to raise sex IQ. And really, sex IQ, sexual intelligence and sexual integrity really go together. That's really the matchup there. So trying to raise both sex IQ, which also at the same time you're raising sexual integrity.
That's right. Well, God bless you, Dr. Joe Malone. He's going to be my next best friend, my future guest. Expect to see him regularly because we've just got too much to talk about. We both love the Lord. We both want to save your marriage before it starts and after it starts. And we just want you to live a holy life that is fun and exciting, has a great sex life as well, because God is the author of our sex lives, and he let's just do it his way. So please share this with your friends. Go to my website, breakfastwithbacon.com, and see all the other amazing guests that God has brought me. Go to my YouTube channel, probably where you're seeing this. I'm on Rumble. Like me on Instagram, Facebook, all those places that we need to share. We are struggling a lot with cancellation culture. So it's best if you sign up for the newsletters, because once they shut us down, you will still get this valuable information and shows like Dr. Malone. So Dr. Joe, I think you know how I end my shows.
Yep.
So we're going to do this, right? All right.
Okay.
I am Dr. Christine Bacon. You've been watching Breakfast with Bacon, and I'd like to remind you always to live your life
sunny side up.
Got it.